So this discussion is going to focus on the wrist and hand. So we'll be looking at the biomechanics involving the wrist and hand, how it functions with activities, and look at some of the important anatomical characteristics of the wrist and hand. So as we look at the joints at the wrist, and we look at what type of joint classification we look at here. So when we look at the wrist or the radiocarpal joint, the joint classification is it's an ellipsoidal joint. So you can see that here in the picture. Okay, so here's your radiocarpal joint here. You can see that ellipsoidal shape to it. Okay, it has 2 degrees freedom of movement, so the wrist can flex and extend, and it can ulnarly and radially deviate, or adduct and abduct. So some important things to note. So again, the actual wrist joint is referred to as the radiocarpal joint. And you can see if you look at the proximal row of carpals primarily have an articulation with the radius. And an interesting point about the involvement with the ulna, if you look, there is a structure called the TFCC, or the triangular fibrocartilage complex, that rests kind of between the ulna, goes between the ulna and the carpal bones, and between the ulna and the radius. And you could kind of see down here the palmar and dorsal aspects of that anatomical structure. You can see it right here on the dorsal side, and you can see it over here on looking at the palmar side. So that's another important structure that kind of supports the wrist, and there's implications as far as that, with injury. People could tear their TFCC much like they can any other soft tissue structure. So it's also important, though, to look at what's called the mid-carpal joint. So the mid-carpal joint also participates with wrist motion as well. So you have this joint in here. This is called the mid-carpal joint. And the movements that take place at the wrist also take place there. So, flexion, extension, ulnar radial deviation also take place at the mid-carpal joint. So that does also contribute to motion at the wrist as well. Just a couple other things, and these are some anatomical things. So we have the most fractured bone in the wrist. So the most fractured bone in the wrist is the scaphoid bone. And anatomically, if you look at this, you can see part of what makes it the most fractured bone in the wrist is that it actually kind of crosses that mid-carpal joint. So you can see how it kind of crosses over that line. So it, when this is obviously together, they have this separated so you can see, but obviously these bones fit together much more in a uniform fashion. That line of stress could go through there and fracture the scaphoid bone. So that bone is fractured many times. There's some issues with that because it tends not to heal very well. You have your frequently most dislocated bone in the wrist is the lunate. Okay, and you can see the lunate in the picture there as well. So a dislocated lunate is a very commonly dislocated, or the most commonly dislocated carpal bone in the wrist. So as we go through here, you can see we're going to start with the different joints, because now there's a lot of joints that we look at here, and it's really important for you to be able to separate and kind of understand the functions of each one of these joints. So we're going to start with the carpo-metacarpal joints. Okay, and many times students tend to mess this up with the metacarpal phalangeal joints. So the carpo-metacarpal joints are where the carpals articulate with the metacarpals. Okay, so here are your carpals. So, now instead of seeing this all separated, you're seeing this together, and you're seeing these joints separated in this picture. Okay, so here's your carpal metacarpal joints right here. Now, the carpal metacarpal joint at the thumb is unique to the others. So the carpal metacarpal joint at the thumb is, remember, what's called the saddle joint. So you can see the first metacarpal here in the articulation with the trapezium, and it forms a saddle joint, and that's important for a lot of the movement that takes place at the thumb. Now, when you look at the rest of the CMC joints down in here, sorry, I was traveling up a little too far away there. If you look at the rest of the CMC joints, it's really, they will still move, but there will be different amounts of movement depending upon where you're at. So the second CMC, which is right here, that has very minimal movement. The third has even less. The fourth has about 10 to 15 degrees of dorsal volar movement. And the fifth is the most mobile. It's got about 20 to 30 degrees. Okay, so the most mobile is the fifth, the least mobile is the third. Okay, and again, these movements are important for changes in shape in the hand. If you kind of open and close your fist, you can see how your metacarpals, and you can see in particular, watch how your fifth metacarpal kind of almost like wraps around. So that's the most mobile one. Okay. Now, as I said, the first CMC at the thumb is unique because it's going to assist the thumb with motions that occur. So the adduction and abduction, flexion, extension, and opposition and reposition. So opposition is when your thumb and pinky touch each other. Reposition is when they come apart. So that CMC is going to contribute to that movement. If we go up further, you see your other joints. So now here are your metacarpal phalangeal joints. Okay. So your metacarpal phalangeal joints, and then you have your interphalangeal joints. Now at the thumb, you only have an IP joint. So at your four fingers, you actually have a DIP, a distal interphalangeal joint, and a PIP, a proximal interphalangeal joint. At your thumb, you only have an IP joint. Okay. So the thumb only has one. So if you just look at your fingers, you have your proximal, your PIP, the iliac and flex, and you have your distal. Your thumb only has an IP joint. So that's a difference when you're looking at the fingers versus the thumb. And there's a couple other things as far as motions that occur that we'll look at that are a little different between the fingers and the thumb. So looking at some other structures when we look at the fingers and the thumb. So first we'll talk about the volar plates and the collateral ligaments. So what the volar plate does, if you look at this picture here, you could see anatomically where it falls. So it's on that palmar surface. So it's a little soft tissue structure that lines the anterior surface of the joint. And what the volar plate actually does is it helps to increase the range of motion that occurs at the IP joints in the fingers. So if you look here, you could kind of see, so here's your volar plate here. It also supports the anterior joint, but when you go and flex that joint, it actually increases the surface, so it actually allows for some greater range of motion, okay? And that's also, again, a soft tissue structure that could be injured. If, a lot of times you see those get injured in hyperextension injuries. You also have your collateral ligaments that you can see in those collateral ligaments. So you can see the collateral ligaments, just like the collateral ligaments. Most people have heard of the collateral ligaments in the knee. So they support the lateral side of the joints as well. Okay. Now, when we look at the MCP joints, the metacarpal phalangeal joints, are condyloid joints. Now, I'm referring to the MCPs of the four lateral fingers. They have 2 degrees freedom of motion. You could flex and extend, and you could abduct and adduct. Okay. Whereas the IP joints are hinge joints. They have 1 degree freedom of motion. Okay, so they only have 1 degree freedom of motion. You can basically only flex and extend. And again, the ligaments and soft tissue structure will prevent hyperextension. So the volar plates, along with the collateral ligaments, will limit hyperextension and provide some lateral stability to those joints. All right, so when we look at movements at the wrist, so the first thing to note is that when you're looking at the wrist, before we even get into the different motions, it's important to note all motions occur through an axis through the capitate. Okay, so the capitate bone actually kind of acts as the axis of motion where all of these motions take place. And if you look at a picture of the carpal bones and think about these motions, it would make sense. So think about, again, always know your anatomy. Even now, find your capitate bone and think about how all the motions kind of occur around the axis of that particular bone. Okay, so wrist joint extension. So extension at the wrist joint, you have approximately 70 degrees of wrist extension. And interestingly enough, wrist extension actually occurs primarily at the mid-carpal joint, okay? So we talked about how, both the radiocarpal and mid-carpal joints do contribute to all motions. Well, extension actually occurs mostly at the mid-carpal joint, okay? And when we're talking joint end feels, it's a firm end feel, okay? So if you go and passively extend your wrist, your end feel with that is going to be firm due to the soft tissue stretch of the structures on the palmar surface of the hand into the anterior surface of the wrist. Flexion, you get about 90 degrees of flexion, okay? So again, flexion is going to occur primarily at the radiocarpal joint. Again, that will also be a firm end feel with flexion, so 0 to 90 degrees. That's actually going to occur primarily at the radiocarpal joint. Okay, so flexion more so than extension occurs at the radiocarpal joint. Okay, then we look at ulnar deviation, and again, you should do these motions while we're discussing this. So ulnar deviation, you get about 30 degrees with a firm end feel. Okay, so again, you can do some passive ulnar deviation to yourself. You could feel a firm end feel. Radial deviation, you get a little less, about 20 degrees, and that end feel is actually hard. Okay, so if you go and do that, you actually get a hard end feel, and that's from the contact between the carpal bones and the wrist coming in contact before you reach the end of the range of motion. It's important to note that when you do ulnar and radial deviation, so if you're just doing straight ulnar and radial deviation in the frontal plane, that the extensors and flexors are actually going to work synergistically. Okay, so they're actually going to work together, and the reason is both flexors and extensors do also do ulnar and radial deviation, and if you want to stay in a strict frontal plane with ulnar and radial deviation, they actually have to work together to prevent your hand from going into flexion or extension while you're actually moving. Now again, I had mentioned earlier that the axis of motion goes through the capitate, and that's true. However, as you go through the range of motion, it does sort of start to migrate a little bit. So as you're going through your full range of motion, it's going to migrate because of the scaphoid and the lunate have to rotate. Okay, so as you're kind of moving through the full range of motion, they're going to rotate and cause some translation. Another important thing to note about full range of motion, as you extend your wrist, so as you go into full extension, your ulna and radius actually have to spread apart. Okay, as you fully extend. So as you fully extend that wrist, you're going to get some slight separation of your radius and ulna as you're going through that range of motion. Okay, so looking at movements of the hand, now it's going to be really important with a lot of this to differentiate the thumb versus the other four fingers. Okay, because there's going to be some dynamics as far as the types of joints and how motion occurs at those two. So it's really important to be able to differentiate those. And again, you have to be aware of your anatomy at your hand and fingers, where the metacarpals are versus where the phalanx bones are. Okay, that's one of the things that always kind of messes individuals up in functional anatomy. So you have to know all that. You have to recognize the metacarpals are the bones inside your hands, and then your phalanges, how they kind of go throughout the thumb and the four fingers. Obviously, the thumb only has 2 phalanx bones, and the other 4 fingers have 3. So when we look at the MCP, or the metacarpal phalangeal joint at the fingers, okay, so we're looking at at phalanges 2 through 5. There's 2 degrees freedom of motion. You could flex at that joint, you could extend, you could adduct, and you could abduct. Okay, so that's a condyloid joint with 2 degrees freedom of motion. Okay, you have approximately 90 degrees of flexion. Okay, the end feel for flexion at the MCP for the fingers is either firm or hard. Then you have, obviously, at extension, you have various degrees of hyperextension with a firm end feel. Okay, so that's what you have at the fingers. Again, we're just referring to the fingers right now. We're not looking at the thumb. Okay. For the MCPs at the fingers, the closed pack position is 90 degrees of flexion. So you can see this for yourself. If you flex your MCPs 90 degrees and try to add and abduct them, what you notice is you can't do it, okay? If you are able to do it, look and see, you're probably extending them, okay? So extension is the open packed position of the MCPs, all right? So these are important movement things to note and understand. So again, closed packed position of the MCPs, 90 degrees of flexion. Open packed is extension. Now, some different things about the MCP of the thumb, okay? The metacarpal phalangeal joint at the thumb, okay, only has 1 degree freedom of motion. It's actually a hinge joint, okay? Now, if you say, well, but the thumb could adduct and abduct, here's what I want you to do. Take your hand, grasp your first metacarpal. Don't let it move, okay? Now, you can still flex and extend your thumb, but try to adduct it and abduct it. Okay, notice that you can't do it, all right? So you can't add and abduct your thumb, okay, when you grasp that first metacarpal. That's because adduction and abduction along with opposition requires movement at the carpometacarpal joint at the thumb. So the MCP of the thumb is a hinge joint with only 1 degree freedom of motion. So that's an important thing to note with the difference with the thumb versus the other 4 fingers, okay? Then you have your IP joints, okay? So your interphalangeal joints, when you're looking at the thumb and fingers. So the thumb only has 1 IP joint. The fingers each have 2. You have a proximal interphalangeal joint and a distal interphalangeal joint, okay? All the IP joints are hinge joints with 1 degree freedom of motion. They all flex and extend, okay? So with the, as far as the motion of the IP joints, you get about 120 degrees of flexion at the PIP joints, and at the DIP you get about 90 degrees of flexion. Okay, and you can just see that for yourself. You could flex and extend, and you could kind of see. Obviously, at the thumb, you get about 90 degrees. You only have an IP joint at the thumb. You don't have 2 joints at the thumb. Another thing to note is the difference between extrinsic and intrinsic muscles. So extrinsic muscles at the wrist and hand originate on the forearm and elbow, as opposed to intrinsic muscles, which originate and insert all within the hand. Okay, and then they obviously have various motions. And again, make sure that you're reviewing your muscles and that you know the actions of them, because it's going to allow you to know and understand the movements that occur in some of the functional hand positions that we're going to be talking about. Okay, arthrokinematics, when we look at the wrist, okay, so the joint surfaces, the joint surfaces, you have the concave radius and ulna going along. The convex is through the proximal row of the carpals is the convex surface. So the open and closed packed positions of the wrist, open is in neutral, okay? So when you completely extend the wrist, that's going to put the wrist in its closed packed position. So remember we said about open and closed packed positions. Open packed positions are when the joint surfaces are the furthest apart. Closed packed is when they approximate the most, okay? So when we look at the motions, for instance, and we talk about roll and slide, when we talk about flexion and extension, you have to look at, are you talking about doing something in the open chain versus the closed chain, okay, when you're looking at your motions. So again, note the wrist joint surfaces, okay. Again, the concave surface is your radius and ulna, your convex is your carpal row. So look at you could look at, just simply look at an illustration of the bones in the wrist and see how that comes together when you're doing that. Okay, we look at the hands and fingers. Again, you have to consider the MCP and IP joints when you're doing this. Okay, so again, we already talked about some of the characteristics of those individual joints, so we know the movement. We look at the open pack position. The open pack position of all of the MCP and IP joints. Okay, so the open pack position of all the MCP and IP is 20 degrees of flexion. okay? That's the open pack. All MCP and IP joints, 20 degrees of flexion. The closed pack position is going to be a little different, okay? So the closed pack position of the IP and the MCP at the thumb is full extension, okay? So full extension for the thumb, IP, and MCP. For all of the others, okay, the closed pack position for all of the others is going to be flexion. Okay, so again, the closed pack position for the thumb is going to be full extension. Okay, and then for the MCP of digits 2 through 5, the closed pack position is flexion, which we actually already talked about on the previous slide. Okay, so make sure you have all of your open and closed pack positions for all of the joint surfaces at the wrist, hand, and fingers. All right, so here's where we get into some functional hand positioning. And again, it's important that you know your functional anatomy so you can kind of see this. So we kind of take it for granted what we do with our wrists and hands every day, but we do so many different precise movements with them, okay? So again, proper function of the hands depends on positioning from the shoulder and elbow. So again, you think of that whole kinematic chain. We need to get our hand and wrist in appropriate positions through the movement at the shoulder and at the elbow. So we're looking at here is we're looking at different types of power grips. So we're going to start by looking at the power grips, okay? So we look here at what's called the cylindrical grip, okay? So you can kind of see note the position of the thumb and the fingers in the cylindrical grip, okay? And then you have a fist grip. Okay, now you say, well, what's the difference between the two? Well, if you look at the thumb in the fist grip, it's actually in contact with the other fingers. Okay, so what I want you to think about, okay, in order to do the cylindrical grip, what position do you have to put your thumb in order to grasp that type of surface? Okay, so think about that. Think about how the thumb has to be positioned. What movements is the thumb going through in order to put itself in that position? Here we have two other types of grip. Over here we have what's called a hook grip. Now, this is going to confuse some people that are in the strength conditioning classes. When we talk about a hook grip in weightlifting and strength training, we actually use the thumb for that. So in weightlifting and strength training, the hook grip is where the thumb wraps around the bar and then your fingers wrap around your thumb. This is just, we'll call this an activities of daily living hook grip. So you see, in this case, the hook grip does not involve the thumb, okay? You have your fingers flexed, hooked onto the handle. Over here, you have what's called a spherical grip, okay? So in order to grasp something that's round, again, I want you to note your position of the thumb with the spherical grip, okay? This is a spherical grip. So hook grip, spherical grip, okay? Again, these power grips are done in order to grasp, you know, objects with our hands that we don't need a ton of precision for. Now here we have our precision grips, okay? So we have 3 different precision grips in this picture. Okay, so we're going to go through each one of these. So over here, we have what's called a lateral pinch grip. Okay, so this is called a lateral pinch grip. So this picture here, grasping the key, is a lateral pinch grip. What you notice, the pad of the thumb gets pushed along the lateral aspect of the index finger. Okay, so you see them holding the key. So that's called a lateral pinch. Down here, we have what's called a 3-pronged chuck. So in this case, the thumb actually rotates the thumb so it comes in contact with digits 2 and 3. Okay, so remember, when we're numbering our digits, the thumb is 1, then your index finger is 2, and then counting through 5. Okay, so the 3-pronged chuck grip is when the thumb rotates so it comes into contact with digits 2 and 3. Up here, we have what's called the tip-to-tip pinch. Okay, so the thumb and index finger, the pads are facing one another. So you have two different pinch grips. So note the qualities of each one of these so you don't get them mixed up. In the lateral pinch, the pad of the thumb is along the lateral aspect of the index finger. In the tip to tip pinch, the index finger faces the pads with one another. Again, I want you to think about what the thumb is doing to put itself in each one of these positions. Okay, so just as a little thought experiment, and when you go back to review your notes, think about what the thumb has to be doing in each one of these in order to carry out those different grips. So again, now we just look at other functional movement information. Again, you need to make sure your anatomy with this so that you're understanding kind of what's going on. If you think of the action of grasping, the action of the fist closing, okay? Now, if you think about the fist closing, so you're obviously flexing your fingers. So just make a fist with your hand, okay? Now, you notice in order for you to make a fist without your wrist moving, okay, your wrist extensors actually have to contract. The reason being is if your wrist extensors didn't contract when you made a fist, think about what would happen. Remember, your long finger flexors, your extrinsic finger flexors, cross the wrist joint. So if you flexed your fingers and your wrist extensors didn't contract, it would cause your wrist to flex. So every time you made a fist, this is the complexity of the wrist and hand. If the wrist extensors didn't contract to stabilize, every time you made a fist, your wrist would flex because of the pulling action from the finger flexors, okay? But because we get that stabilizing action of the wrist extensors, the fist is able to be made without you flexing your wrist, okay? Now notice also what happens when you flex your wrist. So if you make a fist and you do flex your wrist, which you can still do, what do you notice happens to your fist? Okay, so make a really, really tight fist. Now flex your wrist. Okay, what you should be noticing, okay, is that your fist, that tightly clenched fist, actually loosens a little bit. Okay, so you actually start to, your fist will actually loosen as you flex. Okay, and again, that's because basically you're taking your finger flexors and you're actually shortening them a little bit more over your wrist joint now. Okay, so you're actually losing some strength. So when you make a fist, you get that stabilizing action of your wrist extensors. You put your finger flexors in a little bit more of an optimal position when you do that. So we talk about functional position of the wrist. The functional position of the wrist is about 20 to 35 degrees of extension with a little bit of ulnar deviation. A lot of splints that you get made, a lot of times when your wrist has to be immobilized for like an injury or an issue with your wrist and hand, many times that's how they stabilize the wrist. And the reason for that is because that's deemed the functional position of the wrist because of the position it puts it in and how that impacts the tendons that go up to the fingers. And it's also important to note your long finger flexors. You have two groups of long finger flexors. You have the flexor digitorum superficialis and you have the flexor digitorum profundus. Okay, so the flexor digitorum profundus goes all the way up past the DIP. So you could isolate the flexor digitorum profundus by stabilizing the PIP and flexing your DIP. That gets the profundus. If you want to get the superficialis to contract, now you go down to the MCP and you flex your PIP. Okay, so you have two different insertion points for those long finger flexors. Okay, so again, if you're having trouble remembering, go back. Your book has a lot of really good illustrations of the muscles and things like that. Make sure you're doing that as a part of your review for this discussion if you're finding that you're having trouble kind of going back and remembering that. So again, the long finger flexors, the flexor digitorum profundus goes all the way up to the DIP, the superficialis functions at the PIP. And we also have our intrinsic muscles. So again, the intrinsic muscles all originate inside the hand. Okay, so they originate and insert all inside the hand. So we have two positions that you see here. You have what's called the intrinsic plus position. So the intrinsic plus position is what we deal with right here. That's the tabletop position. and then you have the intrinsic minus, okay, which is this over here. So the intrinsic plus position is the tabletop position. Now, for therapeutic purpose, what this does is it helps to minimize tension between the intrinsics and the long finger extensors, okay? So this is actually like a movement activity that people will do. They'll just kind of have their fingers extended and they'll flex them and create this tabletop position. That's to minimize tension between the intrinsics and the long finger extensors. Over here, you have the intrinsic minus position, okay? So you could kind of see like you're basically have the MCPs in extension and the PIP and DIP in flexion. What that is for, again, it's called the intrinsic minus. That's to minimize adhesions between the flexor digitorum superficialis and the profundus, okay? So again, these are both positions and hand things that people could do as a part of therapy to kind of minimize that. Because you have to be thinking, you know, different types of injuries and stuff like that. All these tendons are all very close to one another. The hand's a very delicate area, and therefore you need to make sure that you're making sure that you're getting movement between all of the tendons and everything, and that it's smooth for functional hand positioning. So again, some other things to kind of note when we're looking at the fingers. Again, we have all these different joints and many different tendons that kind of come across them. Okay, so we need a balance of all of these muscles crossing all the joints, and in particularly distally. Now, when we look at this picture, we have actually two different injuries that are very common to occur at the hand with the fingers. We have what's called a boutonniere deformity. That's what we have right here. And we have over here what's called the swan neck deformity. Now, these are two different injuries involving different structures, and if you look, the picture is kind of illustrating what happens. So in the case of in what's called a boutonniere deformity, the central slip of the extensor digitorum, okay, so here's the extensor digitorum. This is another picture showing that. So there's two different slips, okay, so that long finger extensor that goes up the back of your fingers. There's a central slip, and then there's lateral bands. The lateral bands go up past the DIP, so they get extension at the DIP. The central slip is responsible for extending the PIP. In the case of a boutonniere deformity, that central slip tears. And what that ends up doing is the distal insertion remains. So what you end up getting is a situation over time where those central slips start to fall, and they actually produce flexion at the PIP. So as these lateral bands start to slip, okay, so the lateral bands, because of that tear, start to slip down, they actually cause the PIP to flex, okay? The DIP still stays in extension, but basically what you end up getting is a deformity where your PIP remains in flexion and your DIP remains extended. Okay, that's a boutonniere deformity. Now, a swan neck deformity, okay, the swan neck deformity does just the opposite. In the case of a swan neck deformity, the PIP deforms into hyperextension, and that causes increased tension on the flexors, causing the PIP, or the DIP rather, to flex. So this is an injury that involves the volar plate. So if you remember going back to the beginning, that we have that soft tissue structure on the anterior surface of our IP joints, the volar plate. If that volar plate tears, it actually causes a deformity that ends up creating a pulling force, causing the PIP to be in extension, actually into hyperextension. That puts tension on the flexors, causing the DIP to deform into flexion. Okay, so this finger will basically look like this. They'll have a little bit of hyperextension here. They'll be flexed here. In the case of the boutonniere deformity, you have flexion at the PIP. So these are two opposite things occurring. Here's flexion at the PIP, extension at the DIP. This is extension into hyperextension at the PIP, flexion at the DIP. All right, all based upon the tissue structures that happen. So what this is illustrating is if you have some sort of injury, soft tissue injury, it's going to affect all of the joints within the finger. So even though the injury over here with the boutonniere deformity only directly affects the PIP, it ends up creating a deformity and causing issues at the DIP as well. And you have the same situation over here with the swan neck deformity. So looking at the thumb and what it does, again, the thumb's involved in all the grips except for one. The only grip that it's not involved with is the hook grip. Again, for those of you in the strength and conditioning classes, the hook grip we refer to in this class is a different functional grip than the hook grip we talk about. So make sure you don't confuse that, okay? But the thumb does represent a good portion of the hand function. It's important to note that. So, without the thumb, we would lose a grip with large amount of our mobility and the ability to handle certain objects. So I had mentioned this earlier, the importance of the carpo-metacarpal joint at the thumb, okay? So the carpo-metacarpal joints at the other metacarpals, 2 through 5, do move slightly. But at the thumb, there's going to be a lot more mobility, okay? So the CMC is actually at the thumb is actually a saddle joint with 2 degrees freedom of motion. Okay, it does abduction and adduction and opposition and reposition. Okay, remember opposition is when you bring the thumb across the hand to the fifth finger. Okay, so that's an important thing to note at the thumb. Again, add and abduction, opposition and reposition occurs at the CMC joint. Again, the MCP and IP joint, the MCP at the thumb is more stable than the other MCPs because of the fact it is a hinge joint. At the IP joint, you have about 90 degrees of flexion, and then you can get much more hyperextension typically out of the IP joint at the thumb than you can at the other fingers. So if you look at your own thumb and just completely extend the entire thumb, you can see usually you get more, and even passively you could probably squeeze a little bit more out of the thumb, more so than you can in the other fingers. So this just brings and ties in, again, a little bit of muscle synergy at the wrist with the thumb and the little finger. So these are some little functional things. Again, the hand is so complex from the standpoint of positioning because everything has to be so precise. So when you abduct your little finger, so just look at your hand and just abduct. Notice you could abduct your little finger. Okay, you actually have a muscle that does that, the abductor digiti minimi. Okay, will actually abduct your little finger. In order for that to happen, just that little motion, so just sit there and just abduct your little finger. Well, for that to happen just like that without any other issues, the flexor carpi ulnaris has to contract in order to do that. And in order to keep your hand in a neutral position, the abductor pollicis longus needs to contract to prevent ulnar deviation. So in other words, the abductor pollicis didn't contract when you did that, your wrist would go into ulnar deviation, which you don't want to have happen. You just want to move your little finger, okay? So the abductor pollicis longus is going to contract in order for you to do that. When you extend your thumb, okay, just go in the thumb extension, the extensor carpi ulnaris is going to contract to prevent radial deviation. So if you extended your thumb, remember your extensor pollicis crosses your wrist. If every time you extended your thumb and the extensor carpi ulnaris didn't contract to stabilize the wrist, you'd always radially deviate your hand. So think about it. Every time you extend your thumb, you'd have to radially deviate your hand. That wouldn't be very functional. You want to be able to move that thumb independently. Thumb flexion, the same thing. The palmaris longus is going to assist, and the extensor carpi radialis brevis is going to contract. Okay, what that's going to do is prevent your hand from going into ulnar deviation. Okay, so just these little motions again, and these aren't the only things. These are just examples, and I want you to be aware of to know that there's a lot of muscle synergy at the wrist and hand with the thumb and the little finger, just to stabilize and make sure that your hand just doesn't start doing a bunch of uncoordinated things. Again, the movements with our hands and wrists has to be very precise. So in order to do that, we have to have other muscles contracting in order to stabilize the wrist and hand to limit your motions. And these are your various learning outcomes. So again, go back, look at some of those relationships, particularly when we talk about the the wrist and hand, the open closed pack position. Think about your convex concave rules with all of the different joints. Again, that's an ongoing theme with a lot of this stuff. I really want to make sure that you guys get that information down. And again, just go back and review it again. You know, when I'm telling you to do these hand motions, do it. If you do it, you could actually get to see, you know, we take it for granted all these different motions at the wrist and hand, but how precise and the amount of other muscle action that has to occur in order for us to do them.